At Cook Children's, we've made a promise to improve the lives of every child in our region. Our promise means bringing innovative breakthroughs and family-centered care to all of our patients. We often start with the littlest babies in our Newborn Intensive Care Unit. These babies need specialized care in a warm and inviting place where the whole family can heal together. It gives them a new beginning, the chance to begin their experience as a family sooner.
It's the unit of miracles. I don't know any other way to say it. We have interventions and specialists and procedures that we can do to make the impossible possible sometimes.
My favorite part about working in the Cook Children's NICU is really helping to take care of not just the babies, but also the families that come to us. Whenever a child or an infant's admitted to the hospital, the whole family's admitted to the hospital.
When I take care of a patient, I take care of them as if they were my son or daughter.
I love children. I love newborns, but I also love critical care medicine.
Aside from a baby still being in the womb with the mom, and aside from being at home healthy and strong and thriving, that it's probably the next best place for them.
I found out that my son William was going to need help from Cook Children's as soon as the whole birth process started. William was a perfectly normal pregnancy. We had no warning. All of the tests came out perfect. There was no reason to think that there was anything wrong. We ended up in an emergency cesarean situation at 34 weeks. I was taken to a local hospital, and after William was delivered, it was very obvious that he needed a neonatologist badly. I'm a first-time mom, and I put my first-time mom pants on, and I looked at her and I said, well, are you the best or not? And she said, we need to get him to Cook Children's. And so a transport team was called. They arrived with this large isolette that looked like it could take a bomb. So I felt really prepared to hand my son over. And I pulled one of them aside and I said, I need you to understand that I'm giving you my baby. So I want you to know that you're taking my place. And she said, I will take care of your son like he's my own. And I will call you personally if there's a problem. And so I felt confident handing over my most precious gift to somebody who had instantly earned my trust. I was broken. The umbilical cord couldn't stretch far enough. It was difficult to be brave. Once treatment started, we had glimpses of hope every time the physician would call. The phone calls closed the distance between my son and I. Our values and our beliefs were taken into consideration. I was listened to and allowed to participate in his care. One of my favorite memories was the first time I held William. I hadn't held him in 4 weeks, and a physical therapist came up and asked me, have you held your baby yet? And I teared up because there's a ventilator and there's IV lines and monitors. How can I hold this baby with all of these things? And she said, we'll take care of it. And so I sat down in a chair and the physical therapist and the nurse handed me my baby. And we snuggled. And it was so intimate and warm and beautiful. The staff made sure that there were no interruptions, that I just got to be a mom. The nurses and physicians at Cook Children's did the rest.
Our staff toured many NICUs around the country. We've read every article on single room design to make sure that all those best practices and other people's experiences were incorporated into not only the design of the unit, but the workflow of the unit and the way the care is provided. The administration at Cook Children's has been very forward-thinking in saying these are things we need to do for our NICU to make it the best in the country. And we think we do have one of the best NICUs in the country.
Everyone involved in the care of our patients, they have a certain affinity for babies and children in general. They have a certain calling to be in that population, and I really feel like it makes a difference.
Cook Children's is an amazing place to be. It is the only place I ever wanted to be as a nurse, and I'm very privileged to be an employee here.
I would encourage any parent who knows their child is going to need a NICU to support them, or a parent who's in an emergency situation like I was, to really consider Cook Children's. The physicians are fantastic. The nurses are superior beyond imagination. They are my heroes. Everything about Cook Children's made me feel like something good was going to happen, and it did.
The Cook Children's Neonatal Intensive Care Unit, a place of endless possibilities for new beginnings.